not technically a cosmetic surgeon. I'm more of a reconstructive surgeon. So cosmetic surgery is a subset of reconstructive surgery. I try not to call myself a plastic surgeon also. I'm more interested in the reconstructive aspect, meaning that when people have accidents or trauma or burn, I'm the one who goes and tries to reconstruct whatever it is has been burned or has been removed. For instance, if somebody, a dog bit somebody's nose, my job is to find a nose for that person and make sure that the nose is better than the original or even close to the original. So I'm more of a reconstructive. I tend not to do a lot of plastic surgery. But my speech today is about iatrogenic injury in Ghana, a perspective of a cosmetic surgeon. I do cosmetic surgery, but what I do now in Ghana is I tend to get a lot of complications, and I do a lot of what we call a second opinion. So somebody goes and gets some diagnosis, and then people come to me for second opinion. So I'll tell you a little bit of my background. So I finished secondary school here, then I went to the US. So I did, in the US, medicine is a second degree. So I did my first degree, then I did my master's, then I went to medical school. Then after medical school, I went to surgery school. Then after surgery school, I subspecialized. So I've been to school for so many years. But so there's a little bit of difference from the Ghana system to the American system. So sometimes I need to explain that. So in Ghana, I do a lot of, what the lady was talking, the patient experiences. I also get a lot of misdiagnosis, and I have to go back and look at the x-rays and the consultations, the histories and physicals, and then also do my own assessment and come back with what I think the problem is. I've seen a lot of what is happening, what we call misdiagnosis. So if I was supposed to give a speech here and I chose my own topic, I'll choose the misdiagnosis aspect, because I had somebody who was taking medicine for prostate cancer, and they didn't have prostate cancer, they had lung cancer. So I feel like that one is even more important than the cosmetic surgery aspect. So if I can digress and talk about that a little bit. One of the problems I see is that there is not some sort of a thorough evaluation of the patients when they come and they see us, the physicians. Or another thing is that one doctor will give a diagnosis, then the next time the person comes to the hospital, somebody looks in the chart or the folder, and then they diagnose the last diagnosis the person had, instead of doing now a whole different consultation, getting new x-rays, getting new labs, and really having a proper differential diagnosis. Or they have that differential diagnosis and they pick one, and they stick with the one that they think it is, without really eliminating the other diagnosis by way of lab, or by way of history and physical, or by way of your x-rays. So every day, like this week, I have about 5 people coming to me, and all they want is a second opinion. A lot of our patients don't also know that there's an opportunity to get a second opinion. So somebody goes to the hospital, they're diagnosed, and they feel like that is it. They don't have an option to go and see another doctor to see, okay, this is what they've diagnosed me with. Can you help me to make sure that before I go and take chemotherapy, that I really have prostate cancer, or that I really have lung cancer? And it is an avenue that I think in Ghana, most people don't know that they can even get a consultation just for that. So I've been going around teaching that whole second opinion consult. Go and check if you are not sure. Because I also see that, like some of our patient experiences we're talking about, I also see that sometimes it's difficult for patients to ask questions here. And the moment you ask questions, you are seen as too known. You think you know everything. As for this girl, she came from America and she thinks that she knows everything. So it's very difficult for people to query what the doctor is even telling them about what is wrong with them. It is difficult for people to query what the nurse is telling me about what medicine I'm going to get. The moment I say, excuse me, tell me what medicine it is, and why are you giving it to me? And is it one for pain, or this one is for the HIV, or this one is for this? The moment you say that, then they start looking at you differently. Then you are difficult. Then you can't ask questions. So a lot of our people are taking medicines, they're being given diagnosis, and they can't even ask the basic question. Wait a second, doc. I'm Fantis, I have to speak Fantis small. Sure the more lung cancer now. I'm going to Dr. Grace Ayensu Dankwa to ask. Give me 2 weeks and let me go and check. You can't even say that to a physician or a nurse in this country. I think that you won't even come back again. It's like it's like you're writing your death sentence right there. No, but as part of, I think the topic is about patient advocacy, isn't it? So as part of, I'm a patient advocate. So I always advocate for people to ask questions. You have to ask. It is your life, it is your health. Nobody knows your body better than you. So me, before you give me medicine and you say, oh, the doctor said I should give you this, please, which one is this one? What is the name of this one? And why am I taking it? Before I put anything in my mouth, I have to know what it is, the source of it, where it's coming, and why I'm putting it in my mouth. Because 80% of who you are is what you eat and what you drink and the stuff you put in your mouth. So if 80% of your body is going to be healthy, you need to know exactly what you're putting in your mouth. So whether it's medicine, whether it's alcohol, whether it's an herb, whether it's something you are sniffing or something you are smoking, it is all stuff you're putting in your body. You have to know. What is it? What is in it? Please, where is this one coming from? You have to know as part. We need to teach patients these things. Otherwise, we will continue to have these meetings. I have a whole speech on plastic surgery. But have you seen how I have nicely diverted, and I'm not talking about cosmetic surgery? Because I feel like one of the most important things in our healthcare is that patient advocacy, where the patient is allowed to ask questions. I trained in the US. I can't even tell your spouse what is wrong with you unless you give me permission to tell your spouse. People come to me and they say, oh, doc, and so we went and they finished and the doctor called my husband. I mean, there's nothing wrong with it if that is what you want. But the doctor is not allowed to call your husband and tell your husband unless you have given explicit, for me, even written permit that I can tell your husband what is wrong with you. But here, the rules are maybe a little bit lax, and so we ask questions, we send the thing to the children, we send to the spouse. Sometimes even the spouse is in the clinic in consultation with us, and we don't say, wait a second, sit outside. As a plastic surgeon, or sometimes when I do plastic surgery, I actually get people bringing their spouses or their partners to me, and they say, oh, doc, she needs a BBL. And I'm thinking, okay, you think she needs a BBL? Can you give me 5 seconds? Let me examine her. But when I say give me 5 seconds to examine her, it's not because I'm really examining her. I want to know if she really wants that BBL. I know it's free. Somebody's paying for it. But does she really want it? So as soon as the person steps out, I say, listen, I know your husband brought you and he thinks that you need a BBL and he will pay for it. But let me ask you, do you yourself really, truly need a BBL? Is the answer yes, then I know what to do. If the answer is no, then I know how to divert the issue. So even though I'm in the consultation room, I'm acting more like a counselor. Because we need that kind of education, that patient education. The hospitals have to have a patient advocacy department. That patient advocacy department will save a lot of lives. Because people will go there. If something goes wrong, they'll go to patient advocacy. In most of the US hospitals, we have patient advocacy, but we also even have pastors and priests and things in that advocacy department. So it serves as like pastoral care plus advocacy, because especially even in Ghana here, most of us will go to our priest or our pastor or our elder in church with a disease before sometimes we even come to the hospital. By the time we get to the hospital, we would have gone through all those places And maybe oftentimes the hospital is the last place we come. So before I see the patient, I have to know that you have gone to your pastor, you're this, you're that, you're that. Do you really want me to go back and talk to your pastor as part of your healing process? Do you want me to talk to your spouse as part of the healing process? Do you really want me to have this conversation with your children? I need you to give me the permit. If you say no, doc, please, don't tell my husband, don't tell my children. I won't tell them. I am bound by what you, the patient in front of me, what you want. But we are not teaching that. So the patient come and oftentimes they are at the mercy of us. Some of the things we say, as I was sitting here, the two people that were talking about the experience, some of the things we as healthcare workers, some of the things we tell the patient, by the time the patient comes into the room, most of us are feeling that we're even superior more than our patient. In America, and I hate to use that because that's where I learned everything in my medicine. If my patient spits on me, I have to say, oh, thank you for spitting on me, but why did you spit on me? You understand? I can be like, oh my God, and you spat on me, so I'll be like, oh, thank you, but why? Why are you spitting on me? I'm here to help you. You understand? I can never, ever, it's a never event where you have a patient in front of you and you are saying some of these things I heard them say in terms of personal experience. You know, I've been to hospitals. I don't really work in any particular hospital. I do global surgery, so I teach people how to do minimally invasive surgery around the country and around the world. But I've been to hospitals, especially the maternity part, and sometimes some of the things I hear, I cringe. They're yelling at the patient, and you, why are you here? You have too many children. Why are you coming for your sixth child? And your husband is not even here. It is as if, like us, the healthcare workers, we are not even checking how we interact with our patient and what we say to the patient. Let me tell you something. We will not have jobs if we don't have these patients. We cannot be paid if we don't have the patients. We will not have a hospital if somebody is not working in. You will not have a consultation room if somebody doesn't need consultation. So our patient is our number one priority at all times. You cannot deviate from that. We need to respect our patient. We need to let them ask us questions, because the only way they can understand and they can be in that treatment path with you is if the person understands. They call me doc. I'm say, and I'm waiting in suno. Is that the thing I'm waiting in suno? Oh, doc, I'm can't tell me. I'm catch me say me here surgery. Me call almost waiting in suno. Are you sure they took your insuno, or they took the stomach, or they took the kidney or the liver? Are you sure you know exactly what the surgery is? Then I say, okay, let me see your scar. Because based on the scar, you can tell what kind of procedure they had. Then it's like, it's probably an appendectomy. But the insuno is there, but the incision tells me that it is not a real intestinal resection. I don't even know how to call that procedure where you mentioned. So the issue is, please, I'm just pleading, and this forum is the perfect forum for me to plead, is that let us respect our patients. Especially we should allow them to ask us questions. We cannot be healthcare workers and treat the people the way we treat them. Someday, one day, it will be you and I sitting in front of some small boy, small girl, behavior school. You understand? Our children, now you have seen how young the doctors and the nurses, they look at her. We'll be sitting in front of them, and now we have a medical problem. Is that how we want them to treat us? Never. You want to be able to understand your disease process. You want to be able to work with the nurse. Okay, so, when you're retro, na kofie, na koforedu, na oche retro, na sa. That is when you go home, you'll be so diligent. You won't miss one day. Because I took time out to explain to you what the consequences of if you don't take this medicine, what will happen. But if I don't, and you come, and you, where did you go? Who did you sleep with? How did you get retro? Even retro cry is the last end. The other things that we get from sexually transmitted is more common, like the gonorrhea and the other issues that we have, STDs or STIs, is way more than retro. The, let's say, incidence and prevalence of those are higher than retro. So when we're talking about sexually transmitted disease, let us not victimize the retro person. There's all ranges of other things that is even more common that people are spreading now. Hepatitis B is now even endemic in this country. It is a sexually transmitted disease. So if we are not victimizing the hepatitis B person, why must we victimize the retro person? So my humble appeal is that by the end of this conference, that we will all have, especially when the head of Ghana Health Service is here, that we will have in our hospitals or from the Ghana Health Service a real look at patient advocacy. Because when we do, now I know there's a lawyer and a judge here, right? So when we do, we won't be able to go, the medical legal issues will decrease. Because when people understand, their first option will not go to court. If you are in the same place with your patient, for me, all my patients are my friends. As soon as I operate on you, you are my friend forever. Because I have to call you at night and find out, so how are you doing? I have to, at the end of the day, go through my patient list. Sometimes I know that I'm a politician, so I'm doing politics somewhere in some village, right? But even while I'm doing politics, I have to take the day's list of patients that came and call at least 5 of them and ask, how was your experience in that clinic? I'm not there. I'm not in the treatment room. I don't know what my nurses are doing. The only way I can find out is what the patients are telling me. And sometimes if they know it's me and they're friends with the nurses, they won't even tell me the truth because it has become some way. So what I do is that I will let somebody call. So how was your experience there? What happened? Did the patient treat you well? Did the nurses treat you well? Do you have any issues? If you tell me now, I can fix it. But if you don't tell me, then the problem will continue. And when they tell me, it's not to victimize my nurses or to victimize my doctors, but to let me know what system do I have to put in place to let my nurses and doctors understand the importance of that whole patient care. We are here because of our patients. They are the most important people in the whole hierarchy of the medical field. They need to get our best, and we need to allow them to question us, to ask questions. And the moment you start, that your patient asks you a question and you don't get angry, that is when you see that you are getting so many more patients. Right now, my list is full. Everybody wants second opinion. I don't even know where they hear my name. But they're asking for second opinions. I'm not even advertising. I'm not talking to anybody. But it is our interpersonal relationships. Especially me, I'm a surgeon, especially the big bosses. Those of us who are supposed to be like the consultants, specialists for no. Here we don't come to work. Because we think that we are the hierarchy. But where I come from, the specialist is in the hospital first. Like, I have to be there first before my residents come. I have to make myself available for my residents. I have to be in the theater first, so my residents come and I'm there and I'm scrubbed and I'm waiting. Sometimes I sit back and let them do the procedure. But I am the consultant. I am the specialist. If I am there, the chances of a mistake, if I am there, the chances I'm going to have a more opportunity to teach my residents. If I am there, the opportunity to teach the nurses. Sometimes I even go into the theater and I'm the scrub nurse. Just so I see what happens to my residents. And I'm teaching the scrub nurse. Sometimes I'm an anesthesiologist, or the anesthesiologist is there, or the nurse anesthetist is there. But sometimes I sit behind that console to work with them. So please, all of us, we have taken some oath to first do no harm. Second of all, that we are going to use all of our experience to the best of our knowledge, to everywhere we have been, to everything. We will not discriminate against certain people based on disease, based on crime, based on tribe, based on anything. So we, in a sense, our job, we are like, it's a calling to a certain extent. That is why no matter how much they pay you, it's not enough. Because we do way more work than the money that comes. But it is a calling, and you really have to be passionate about what you do. We need to treat our patients well so that we can have a healthy population. So, head of Ghana Health Service, I'm expecting that from this, we have some real, action plan as to how to move forward. I'm a member of parliament now, but I'm willing to support any, if I have to go and do some new policies and everything. If you guys tell me what it is you need, I will support it, I will champion it, and we can have real good patient advocacy that means well for the patient, and someday when you and I are there, that policy will also augur well for all of us, and then we can have a healthy population in this country, and a population that is willing and able to talk to each other and interact and move the country forward. On the plastic surgery thing, now, I finished that one, but the plastic surgery thing, the issues we're having here in Ghana with plastic surgery is that too many people are, I can read my speech, but I don't want to. Too many people are watching too much TV. And they are on TikTok, and they're on social media, and they think that everybody needs a BBL. And the men too. Okay, I won't go there. I won't go there. Should I go? Okay, so the men too, you are watching the backside too much. You understand? Trust me, the backside should be the least of your issues. It doesn't add or subtract anything. It is about relationships, interpersonal, again, relationships. So big backside or small backside doesn't add anything. And the things that they are putting into the backside is not very good. A lot of these people, you see young girls, and she has put 50 kilos in her backside, and she's walking like a duck. No, I'm serious. Me, I've seen it. She's walking like a duck. Every time she passes, everybody is looking at her. But they're not looking at her for the right reasons. They're looking at them because they look like caricatures. You understand? You look like a poster. It is not real. Even cosmetic surgery must look real. Even now, as plastic surgeons or reconstructive surgeons, we are heading towards what we call like a realism. So we want the person to maybe the body enhanced, but not look like a caricature. So even we are pulling back. But what I'm seeing here is that the old ways, where you do everything too much. And remember, we live in Africa, there's prone to infection. Even the environment itself is not that clean. So anytime you put a foreign body in your body, you are starting problems that you can't even solve. That diagnosis, they can't diagnose in the hospital. When you start having headaches, because it's some sort of autoimmune thing, that it is one of the most difficult things to diagnose. If you have a foreign body and your body is reacting to that foreign body, like some people, they don't even have fat now. They're putting silicone, they're doing it at home, they're going to spa, the lips is over plumped, the facial fillers and things. You don't even know the product that you are putting in your body. But for how long do you, BD is nice, don't get me wrong. But, and then after they do the BBL, now, imagine me, this little person, my body is not that big. And now I'm going to put like 20 kilos here, 20 kilos here. And now my knees and my skeleton or my thigh, the bone have to carry this weight. By the time I am 45, you can't handle it. The bones are not strong enough because it has carried more weight than it's supposed to carry. And because it has become a fad, and the sad part about it is our celebrities, You know, it's a whole celebrity thing. And everybody is thinking that your waist should be 2 inches and your hips should be 60 inches. So it's like this and like this. But please, I am appealing again. Those of us who do these procedures, let us pull it back a little bit. Not everybody has to look like a caricature. And second of all, I have turned away so many people. They come, Doc, I want to look like this. Photo. Like, madam, no matter what I do, you can never look like this. You understand? I mean, respectfully, not that I do respect all my patients, but even if you are born again, you can't look like this. So please, tone it down. You don't need that much. If you want to be a little bit enhanced, that's fine. Maybe we can find your own fat and do fat transfer. But don't go to any other doctor to let you know that they can do it. Because as for your money, somebody will take it and give you a bad job. And it's not just the body. I have seen people with their teeth. It's all white. Even in teeth history, there's nothing like white color. Because the whitest of the white teeth is not white. You understand? It's not white. But the person is talking and everything is square, 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 pepper. Nobody's teeth is square, 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 pepper. Haven't you guys seen? You know what I'm talking about. So as you are talking to the person, you are looking at the person and you are looking at, there's something wrong. And then as the person is talking, you are trying to figure out what is it. Is it the eyes? Or is the teeth? Or maybe, you know there's something going on, but you can't put your finger on it. Or the lip is too big. So as physicians and as patient advocates again, what I'm also requesting in that, I think that we don't also have enough laws to govern that whole fledgling cosmetic industry. It is getting too large. People are lying about a lot of things. Go and take some medicine and you will lose weight. Trust me, not even lose weight, your hips will be big. There is no medicine that you will take that will give you big hips. It can never happen. So you will take, you will still be skinny. So please, let us as health personnel teach, advocate, teach the people. Let's go on air and also talk, because if we don't talk, then the TikTokers will take over. If we don't talk, then the celebrities, they are going to Turkey, they are going somewhere, they are coming and they are glamorizing these looks like that is how every girl should look. So our teenagers are at risk. And you can tell I hear some young girl who's like a celebrity died or something. So they're glamorizing these things. I beg you, we are all here. We are the stakeholders. We are the ones who can talk for people to hear. Let us take time out and teach these people that you shouldn't have to look like a cartoon character to look good. Actually, it's about character. When it's all said and done, it's your character that matters. So my friend, okay, I'll tell you some fine stories. Doc, I've dated this guy. As soon as he left me, he went to marry the girl. The other girl. I'm like, well, maybe the other girl has a better personality. You are bringing BBL. That girl, she doesn't have BBL, but maybe she's nice to the man. What are you wearing? We'll remove the BBL. Maybe you, I'm just joking. But on a more serious note, please, we are all here. We care about our patients. We care about our health. We care about the health of the nation. We care about the health of Ghanaians. Let us educate. This one is about education, public education, and we'll continue to talk. But I think that eventually, if we continue to talk, that message will stick, and then things will kind of calm down a little bit for us. But so I think that I'll end my speech here. And I will say a big thank you to the organizers of the group for allowing me to have this time. And also thank you to my fellow panelists. And I'm available for any other discussions in the future. Thank you again.